Hello guys, we are going to present a chest intubation. This is the intercostal space on the fifth intercostal space anterior to the mid-axillary line. In female, inframammary line, which is below the nipple, represent fifth or fourth intercostal space. This is the ideal place for chest intubation. Hyperextend the upper leg, drap. After draping, prepare local anesthetics and anesthetize the skin, subcutaneous tissues, intercostal muscle, periosteum, and parietal pleura. Give incision parallel to the ribs. After that, use hemostats. These hemostats do blunt dissection. Be gentle. After dissection, the skin, subcutaneous tissue, intercostal space, puncture the parietal pleura and try to be on superior part of the rib. On inferior, there are the neurovascular bundles. Be careful. After puncture the parietal pleura, spread the hemostats. Insert the finger. Break the adhesions if they are present. Then palpate the lung parenchyma if possible. This is a chest tube. Distally, clamp the tube to avoid the blood or fluid coming out or air. Proximally guide with the hemostat, sometimes not needed. Insert inside the pleural cavity, then remove hemostats and guide the tube posteriorly and upward for the pneumothorax and downward for the hemothorax. If there's fogging, it means inside the pleural cavity. Attach the tube with chest bottle. Thank you guys for watching this video.